Hi everyone, this is our weekly blog, and I've been asked by a number of my students worldwide to try to explain how to treat these very thin pulses that people have. They're usually thin people, they're a little dried out, so they're a yin deficient pulse. The pulse is very thin, it's a little higher than it should be across the board. So the liver pulse is too high, the kidney pulse is too high. Of course, the Sum pulse can't be too high because it's supposed to be superficial anyway. But it's more of a problem in the liver, kidney system, and possibly the digestive system, or the pulses are too thin. These people are always very tense. They're tense people, can be argumentative, they're type A personalities, and they're difficult to treat. And so, what do? Well, first of all, because the pulses are too high, there's an element of yin deficiency with all of them. It depends on whether the pulse is really pounding or not will determine whether how cold the herb should be. Okay? Because the pulse is very thin, we have to widen it out. So we have to use vasodilators. Blood movers and that are known vasodilators, like Dongui and Chuanxiang, or Dongui and Shengma, okay? Or Sanqi even. Those are vasodilators. Then we have to use yin tonics. So if they're very grumpy and irritable and they have emotional ups and downs and they have that very thin pulse and it's too high in the left guan, then you want to use a little bit of a yin tonic like Qi, Ju, Di, Huang Wang. Okay? If the liver pulse and the left chur are too high, you can use Zerbai Di Wang Wang and Qi Ju Di Wang Wang, 20-20. Then 15 Dongui, 15 Chuanxiang. So that's 30, 40, 50, 60, 70. You got 30 left. What are you going to do? Well, it depends on the other pulses. But in general, you're going to need some more blood movers. Not just vasodilators, but actual blood movers. So you can use like Vitality. You can use 20 or 30 grams of Vitality. So you're moving the blood through the vessel, you're widening the vessel out, you're moistening the vessel, trying to get this yin deficiency to go away. And it depends on whether there's a lot of heat or not, then you have to use a little bit of cooling herbs. But the main principle is widen out the vessel, widen it out, and push the vessel down and move blood through the vessel as a way of basically widening it out. What these very thin pulses mean